Good afternoon. I'm Cheryl Stevens, Chair of the Community Development Committee. You are at Cuyahoga County's Community Development Committee meeting on Wednesday, June 1st, 2022. We are in the Ellen C. Connolly Council Chambers at the Cuyahoga County Administrative Headquarters. Madam Clerk, if you would call the roll, please.
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county YouTube page. Also like the record to reflect that Council President Jones has appointed councilman member to the committee today. Calling the roll, Ms. Stevens.
Present.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Simon. Ms. Simon is absent at the moment. Mr. Gallagher. Mr. Gallagher is absent at the moment. Ms. Baker.
Here.
Mr. Miller.
Present.
There's a quorum.
Thank you. I apologize for the late start this afternoon. Just way too many things to cram in a schedule on a daily basis. But this, what we will be hearing in this committee today is incredibly important to the million-plus residents of Cuyahoga County, a specific cohort of those who have housing-based issues, and this is a substantial amount of money that will help many of the residents in our communities. Is there any public comment?
Yes, Madam Chair, we have one person signed in. Lou?
Good afternoon.
Good afternoon.
Actually, I'm here to support our Board of Health. Board of Health is a very important entity in the government. However, I think this particular board has never got enough funding. When COVID-19 pandemic started, the federal CDC guidelines saying all the heavily congregated facilities should be concentrated. But guess what? You have heard my ordeals. When I was tested COVID-19 positive, I was almost murdered by the starvation and dehydration. That means Board of Health do not really have enough manpower to actually check on all the things or other entity supposed to follow. And even till now, Omicron right now rises again, right? So now we have to start wearing masks to come into this building, just for example. But guess what? Normal Health, for example, you already have all the people all stuck back in. Not only stuff back in, of course, there's no social distancing and there's nothing just like before. So we still have to wait till we have some kind of symptoms in order to get tested, because the Metro Health team, their funding, their personnel are also limited. So how would you expect this board to actually carry on this big duty to ensure all the residents can be healthy and productive in the county? I really do not understand. Sure, the two items right now on the agendas are very important, but still, in this particular case, while they have to use all their resources, limited resources, to help out the people outside of these heavily congregated facilities, the people in the county jail, the unhoused in the shelters, our lives still don't really matter much. So I hope all the council members will help, trying to see if there's any way we can change the way we budget our money so the health and human services, these kind of services, will really get properly funded instead of building a bigger new county jail to house more people. There's no justice for that. Thank you very much.
Excuse me, Madam Chair, your microphone.
Thank you. The next item on our agenda is the approval of minutes from May 16th, 2022. Have any of my colleagues had a chance to look at those?
Move to approve.
Is there a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? The minutes are approved. Madam Clerk, can we go to the items referred to committee?
Let the record reflect that Councilmember Simon is in attendance.
Thank you.
Resolution 2022-0135, authorizing a grant award to Cuyahoga County Board of Health in the total amount not to exceed $2,900,000 to support various mission activities.
Hi.
Good
Who
morning.
do we have before us today?
Good morning. Becky Eby with the Cuyahoga County Office of Innovation and Performance. Wanted to provide some brief introductory remarks and then turn it over to our experts at the Board of Health. So the item you have before you today has two components. The first is $1.1 million to support our COVID-19 public health response, as well as an additional $1.8 million for lead mitigation in the Cuyahoga County suburbs. So with that, I will, these items were all included on the list of proposed projects made possible by ARPA by both the executive and council in early March and April. And with that, if you don't have any questions, I will turn it over to Commissioner Harris and his team to walk through these items in greater detail.
Good afternoon. Roderick Harris, Health Commissioner, Cuyahoga County Board of Health. As we see with our new level of high as far as the community levels for COVID in our community, COVID is not done with us yet. I would also say that we must be mindful that COVID doesn't affect all residents equally in our community. Most of the social determinants of health, and we consider those to be housing, access to care, education, and transportation, are affected by COVID for certain populations in our Cuyahoga County Board of Health jurisdiction. As residents stay inside and keep themselves safe from COVID, we also have more lead exposure in some of our homes. And that has become an increasing threat over the past couple of years in certain residents, communities in our neighborhoods. And then also, I will also want to add that many residents have also delayed seeking treatments, whether that's preventive services or even getting vaccinated. And we have certain residents that are less vaccinated than others throughout the county. With the proposed funds in front of you today, CCBH intends to enhance and sustain programs that we've been doing for the past couple of years. These programs do address some of these inequities that I did mention, and I also want to make sure that you understand that these proposed funds will be used to provide resources to eligible homeowners to renovate their homes to prevent lead exposures. We also want to sustain our COVID surveillance, education, and outreach. And then lastly, execute a strategy so that we can deploy a mobile unit to make sure that residents have access to preventive services and vaccinations. We have our team of experts here from the health department to talk about each of these items. We have John Soboleski, who will talk about lead. We also have Jana Rush, who will speak about our COVID outreach and surveillance. And then we also have Aaron Elsas, who will talk about our mobile unit. Any questions?
Do I have questions from one or more of my colleagues?
I have a question.
Sure.
My question is that now that so many people are self-testing for COVID, how do we get an accurate picture of what the current prevalence and spread is?
You'll have a definitely difficult time to get an accurate number. We are not even sure how many people are home testing at this point. We do ask that people report that to the health department, but we haven't been seeing people take us up on that opportunity to report their home tests. And many people test repeatedly as well, so it would be very inaccurate if we try to assume.
I have one question before we go to this as a follow-up. Is it easily accessible on your website? So I test positive for COVID. I'm staying home. I'm being miserable just like everybody else. Can I go, when I open up the Board of Health's website, is it right there in front of my face? Because if I have to search for it and I'm not feeling well, I'm not letting you know. It's like on my list of things, but I'm going back to bed.
We'll go back and make sure that we take a look at that.
Because I'm one of your people. I tested positive 2 weeks ago. I went to the website. I didn't see a thing. I didn't report.
Well, I'm sure someone on my team who will be speaking later might be able to address some of that and give you more insight on where it is on our website.
Really at the very top and easy to find. Because otherwise, I will tell you exactly what the average Cuyahoga County resident is going to do, because I was her.
Okay. Thank you.
Madam Chair.
Yes.
I have a question. Hi, how are you? Welcome to our meeting. I have a question on what we're actually doing, ramping up. I mean, initial conversation with these ARPA funds, there was a description of tracing, and I don't think that's what's happening anymore, right? So this $1.1 million, what exactly is that going to go for?
Well, Jana will speak to that, but we're not doing universal contact tracing anymore.
Right.
But yes, Jana will speak more to what her staff will do when we get to her section of the presentation.
Okay.
Hold on just a second. Ms. Baker, did you have a question?
I did, and maybe this will also be for another speaker, but just as a heads up for a few questions, and just like to maybe get some answers that a lot of people are asking out there that want to know what we're doing, inside here. According to the state website, we have 94% of people 70 to 74 already vaccinated, and we have 90, almost 91% from 65 to 69 vaccinated. And, as we look at these 70%, 80%, so we have really done a pretty decent job, and this is in Cuyahoga County, of encouraging people to get vaccinated. And I'm sure many of those people have gotten the booster, if not once or twice. So it just seems, first of all, they're all questioning why it is that we are still talking about having to do these mandates when they did what they were told to do, and if anything, would make what they would get milder. I guess along with that, I thought we were at a place where we weren't counting cases anymore. We were looking at hospitalizations. And so I would ask you, what is our hospitalization increase at this point? It seems to me that the Omicron, from what I've been reading, is a mild case. Most people, if they do get it, recover. They don't go on the website and report it because they recover. They don't go to the hospitals because they don't need to. So why is it that we are ringing this alarm bell of the sky is falling again? We're back in March 2020, and vaccines, medicines before when you're suspicious that you might have it, medicines while you have it. Why aren't we in a better place, perhaps of easing people's minds, of saying, hey, don't panic like you did in March 2020. We are not in that place. We understand what we have. This is an Omicron. This isn't the Delta variant. I guess I'm asking, are we going to ask to mask up for colds and flus? I mean, I know we can. And on top of that, shouldn't we be encouraging the KN95 masks? That if you're really having a public health crisis, why aren't we encouraging those masks rather than the little paper ones that hardly really, maybe 30% protection? So I guess those are my questions of why it is that we are taking this to such an extreme of mandating again. On Friday, I think the executive put out an order that he highly recommended that everyone wear a mask in this building. And when I came in on Tuesday, there was hardly anyone wearing one because they're not fearful. They figure that they're vaccinated, there's medicines, and they're healthy, and maybe they're at a young state. So when we mandate, then everybody does, and because they have to. But why? Is there a misunderstanding of what people are feeling right now out there? Is there a misunderstanding that when we do have an actual crisis where this is death-related, again, that they won't listen to us because the sky is falling too many times? Is this a question for you or a question for your team of how it is that we can communicate with people to make sure that they can trust us when we say, we think you're smart people. If you want to wear a mask, please wear one. We suggest you wear a KN95 mask so that it really does protect you. And do what is appropriate for you to do. If you suspect you have a cold or you suspect that you might have some symptoms, get tested. I don't understand. Can you help me out there?
So one, I will say that the health department isn't mandating anything. What we do encourage everyone to do is to follow the CDC guidance for your community level. And
well, this building is mandated. So anyone, any public person coming in is mandated.
Right. Any private entity, public entity can always put their mandates in place for their organizations. And so that's what the county exec has done for you all.
So in your position, do you not support that? Do you
No,
think
I highly encourage to follow the recommendations, which is for you to mask indoors, yes. And then I will also say too, I think it's important for people to remember that long COVID does exist. So even if people don't go to the hospital and people don't die from COVID, they can still have long-term complications from catching COVID. Also, we need to remember too that all of our residents aren't vaccinated. Some people are choosing not to get vaccinated, but we also have young people who aren't eligible for vaccination. And then I would say my last point would be too that hospitalizations are going up, but what we don't want to do is have the system to get overwhelmed. And we've had a 3-time increase over the past month in our ED visits for COVID. So I think we're being proactive in our recommendations, and so is the CDC.
so? The position is that there isn't really an alarm now. It's being proactive for something that could come. Is that pretty much where you're at?
Yes.
I'd like to remind the commissioner that you have 2 items on the agenda that you need to address, and we have something else that we need to address.
All right.
So if you have, a couple minutes, get your staff to focus on what they need to share with us so that we can have a positive opinion on what you're presenting to us.
Thank you.
Good afternoon. My name is John Soboleski, and I will be brief, 3 minutes and 35 seconds. I'm here to talk about the lead component. Lead poisoning is not simply a problem confined to the borders of the city of Cleveland. There's also a profound need in 19 first-ring suburbs of our county where more than 200 children less than 6 years of age had blood lead levels greater than 5 micrograms per deciliter in the year 2020. I provided the map of the prevalence, but also listing by community earlier, so you should have those for your reference. And it's also on the map up above, so you can look at that later and look at your communities and see where you fit in. The $1.8 million to support lead poisoning prevention efforts are broken into 3 categories. First category A is to provide support to the HUD Office of Lead Hazard Control and Healthy Homes Lead Hazard Reduction Grant, which was awarded to the Cuyahoga County Board of Health. This grant proposed making 285 units lead safe in the 19 first-ring suburbs. The start date of this grant was in March of 2020, which coincided with the beginning of the pandemic. At that time, a full-scale pandemic response was conducted by the Cuyahoga County Board of Health and Cuyahoga County, which became our top priority, and it took personnel resources away from our day-to-day activities. This pandemic also catastrophically impacted families in their willingness to participate in in-home remediation programs, which feature short-term displacement as well as face-to-face contact with individuals outside their immediate family circle. The majority of these units enrolled in the grant come with an out-of-pocket cost, known as match, when the bricks and mortar lead remediation cost exceeds $10,000 per unit. These homeowner matches range from $500 to more than $10,000. By using these new funds to reduce the homeowner match burden will allow us to catch up on unit production by eliminating the time necessary for homeowners to secure their match dollars, but also eliminate the loss of applicants that cannot meet their out-of-pocket costs. We lose approximately 20% of our enrolled clients because they cannot come up with the required funds. The reduction of the match commitment will also encourage more participation from families meeting the HUD income guidelines of 50 to 80% median income for Cuyahoga County. These funds will reduce the burden to the residents while at the same time allowing us to fully expend the HUD dollars and making us more competitive for future rounds of HUD funding. If we complete the units and fully spend the HUD dollars, we'll be in a very good position to receive future funding as we have through 10 grant awards since 1997. Second category provides support for lead remediation of owner-occupied units, housing children less than 6 years of age at risk for lead exposure that don't meet the income guidelines for the HUD grant, but are at less than 200% of the federal poverty level. The family income is too high to qualify for the HUD grant, but they don't have enough money to make their homes lead safe. This is typically a family that may have 2 incomes, multiple children in our first-ring suburbs, and they are the working poor. The final category provides support to the Comprehensive Childhood Lead Poisoning Prevention Program administered by the Cuyahoga County Board of Health, which identifies children with elevated blood lead levels and intervenes with case management as well as environmental assessments. These families may then be subsequently enrolled into the HUD grant that I mentioned in Category A. So in closing, we appreciate the support of County Council and the long-term partnership with the Cuyahoga County Department of Development, which have allowed us to make over 2,000 housing units lead safe since 1997. Thank you.
Yes. So am I understanding it correctly that the $1,800,000 in this legislation is going to be to help people that don't meet the income requirement for the HUD grant, but are under 200% of poverty?
So approximately 500,000 of the 1.8 is going to support those families that are fit in that donut hole. They don't meet the eligibility for the HUD grant, but they're less than 200% of federal poverty. It's a very common occurrence. We have a family in Lakewood. They have a child that has lead exposure. They don't qualify for the lead grant. They have lead hazards.
Excuse me, can you speak into the microphone, please?
Sorry. So they have lead hazards they need to fix. So this will serve those families that don't meet the income qualifications for the HUD grant.
And what is the other $1,300,000 going to be used for?
That's to support the match dollars that the homeowner has to come up with that participate in the HUD grant. So we have a long attrition. People fall out of the grant because they can't come up. We have ranging up to $10,000 of match dollars. Think of the large frame houses in Cleveland Heights and Lakewood, East Cleveland, that go above what we can spend at the HUD grant. So this money is powerful, it's very helpful, and also the time it takes for families to get that money together drags out our timeline and further limits our ability to produce what we need to produce. So in a sense, we got really hit hard with the pandemic, both from a personnel standpoint to do the grant, but also families didn't want to participate. So this is a makeup, and it also reduces the burden on the residents.
And how many homes are there that we believe need to be remediated where children are at serious risk?
The number is very high. I could get you the exact number that I used in the proposal based upon the demographics we presented, but it's certainly more than we could ever fix. We did preliminary estimates a few years back, and we're talking essentially for all of Cuyahoga County, $100 million funds to make homes lead safe. So it's a really exorbitant number, so we're really trying to piece in what we can and spend the money that we have, and also make sure that we're in a position to get more money by spending the money we have, which is critically important.
Excuse me, Madam Chair, your microphone.
One of the funner pieces of this proposal is the mobile unit. There's lead testing available through that mobile unit as well.
I'm going to say that this mobile unit, even though this is not my area, this is Aaron's area, but it's to provide all types of clinical services, which involves blood lead screening as well. And the key is out in the community where the people are at.
Okay. Any further, Nan?
Thank you, Chair. I'm absolutely in favor of this. I'm disappointed we haven't done more to date. I mean, we have known this problem for years, and it's disappointing that we haven't come farther along. So I'm thankful that we are putting this forward today, and you're using matching funds, which should make the number even greater than what it is that we're spending. These are homes that are, what, since 1978?
Every home built before 1978 potentially could have lead-based paint, but primarily we're looking at really pre-1950. And the older the home, the more likely it's to have lead-based paint at high concentrations and more lead hazards. So you look at the typical bedroom communities, Lakewood, East Cleveland, Cleveland Heights are the top tier. And when you look at those maps that I gave you in the breakdown by neighborhood, you'll see the percentages and the number of children tested in your individual cities. As you go out into the Parmas of the world, the Maple Heights, the risk becomes less, but we still have children that are exposed to lead, but we also have lead hazards in those homes as well.
If I may, if a child is exposed, they live in a home that has lead, what are the chances of that child having difficulties because of it?
That is not, I certainly couldn't cover the medical end adequately, but certainly there's a profound impact on IQ at a very basic level on a population basis. But we also know that it can, at certain levels, depending upon the children, place them into categories that need special educational assistance. And we work with many of our county agencies to make sure that we refer families to programs, but they also refer families to us as well. So we have a very good case manager, and that's what part of this funding is for, to support those activities as well, connecting people to services to help overcome those barriers that may occur with education.
So if I may, so if someone suspects they live in a 1955 home and they suspect that it's probably has lead paint, what do they do in order to get the help? Who do they call?
Well, they would call the Cuyahoga County Board of Health, but our first trigger is always, we're focused because as Mr. Miller pointed out, we have limited resources in terms of how many homes we can affect. So we're really focused on where we have children less than 6 years of age. So if they have a child less than 6 years of age, there's a certain priority in terms of the zip code, and those children should be screened first and foremost. But then our second avenue, if they don't meet the qualification in terms of, thankfully, they don't have a child with lead exposure, we want to enroll them into our grant program. And that's critically important because we can fix those houses, and now the burden to the homeowner has been greatly reduced. We can essentially fix those homes in rapid fashion. And if they don't meet the criteria for the HUD grant, and they're slightly over that income, but they're less than 200% of federal poverty, then we have the county resource to help those families as well. So we're not going to be hopefully missing families, and those that are of upper income hopefully can afford to make those home improvements that reduce lead hazards.
Okay, and just my final question.
I really need to cut this off, Nan, because we still have another issue.
Can I just ask one real quick one?
Hurry.
Right, how many homes are you going to cover? With
285 through the actual HUD grant itself. And then doing the math, we're looking at probably another 20 to 30 units on the what I call less than 200% of federal poverty. Then we're looking at, through our Comprehensive Childhood Lead Poison Prevention Program, approximately 50 families a year is what we've currently been serving.
Thank you, Chair. Appreciate it.
Thank you. Commissioner, we are looking at a piece of legislation authorizing $2.9 million. And is this, are there any special needs for this to move rapidly through the system?
Yes, it is.
Okay, so you would like for us to move this as quickly as possible?
Absolutely.
All right.
Madam Chair, I never got an answer to my question about what they're using the 1.1 million for, and Aaron was supposed to come up. If I could get an answer to that quickly.
Aaron, do you have a quick answer for us?
I can speak to the mobile.
Please give us your name.
Sorry, my name is Erin Alsace. I'm the clinic supervisor at the Board of Health. I can speak to a portion of the funds, which is approximately $250,000 to $300,000 for a mobile health vehicle. This would facilitate the provision of services and enable us to be more responsive to the community needs and continue our COVID vaccine efforts in areas with access issues and high social vulnerability indices. The model we have used so far in our pop-up clinics can also be translated to other vaccination activities using this mobile clinic, such as flu, back to school clinics, and then visiting congregate care settings, which I know was mentioned earlier, including group homes, developmental centers, shelters, substance use treatment centers, and also to reach individuals with mobility and those mobility issues, and for those who are homebound. We also anticipate that this, beyond the COVID efforts, this would also help us expand other community-based services, including, we plan to furnish the vehicle with medical exam equipment that would allow for reproductive health services, including STI and HIV testing and treatment.
How much does that cost?
I'm sorry?
How much will that equipment cost?
So we're anticipating that would be built into that $250,000 to $300,000 range. That is an estimate that we've gained from Metro Health and Cleveland Department of Public Health, using what they had spent on their mobile units, kind of as a ballpark for what we anticipate we would need.
So we have 1.1 million set aside for this, 300,000 for the mobile unit, and what is the other $800,000 for?
I would have to lean on Jana.
That was your question, right?
Yeah.
Hi, good afternoon. Jana Rush. I'm the Director for Epidemiology, Surveillance, and Informatics at the Cuyahoga County Board of Health. So I will speak to the piece as far as the $1.1 million for the COVID-19 funding. And so this funding will be used to cover categories of activities that we've been doing for COVID-19, and that includes case investigation, So contacting cases who are diagnosed with COVID-19 and having them contact their contacts to notify them. Testing, so as more and more people do home tests or seek testing through healthcare providers, we have to process those lab results as they come in. So we'll continue to do that. We'll also be working on infection control and prevention. So we investigate clusters of activity of COVID-19, particularly in congregate care settings, daycare, schools, jails, any type of setting, shelters where people congregate in settings. So we have to work on cluster suppression for that to ensure that COVID-19 is not spreading amongst those vulnerable communities. We'll also continue with our mitigation strategies around vaccination. And so we'll continue to target those communities that have lower vaccination rates throughout Cuyahoga County. And so we plan to continue that throughout the remainder of the year or the subsequent years to come. And then health education and communication. So working to ensure that people understand why masking is important, hand washing, social distancing. So utilizing these tools that we have. So this is what I would say about COVID. You know, COVID is here to stay. And so we have the tools in place to use in order to help mitigate the impacts of COVID. COVID is a novel virus. It can replicate and change over time. And so this is something that we want to implement these tools as quickly as possible as we see things change on the ground.
And you still didn't answer the councilwoman's question.
And
she was very specific about wanting to know how much was being allocated in the 1.1 million beyond the 300,000 for the mobile unit.
Madam Chair, thank you. You told me about programs. So is this money, are we hiring people? Are these temporary employees? Or what exactly is this money doing to continue these? You're telling me you're continuing programs that exist. So how does this money, how is it going to be used to help that continuation?
So yes, the staffing capacity that we've had to build out in order to do these activities has definitely exceeded what our internal capacity has been since this started in March of 2020. So it will be to maintain that staffing surge that we've had to bring on board in order to do all of these activities.
So will the full will 800,000 be spent on staffing, or 500,000 on staffing and 300 on the materials and supplies they need? Do we have any idea, or is this something you're going to need to follow up with us on?
It's okay, Madam Chair. I mean, I get an idea now.
I'd like to have them follow up.
You too. Yeah, but give us specifics.
Why don't you follow up?
Thank you.
Yes, we can definitely follow up. Any other?
Okay, so we need a motion.
Okay, thank you.
Under suspension, you said?
Yes.
Motion to move this resolution to the full council with a recommendation of passage under second reading suspension.
There's a second. All in favor? Any opposed? Commissioner, your first piece of legislation is on its way to council. You're welcome. Okay, next up we have a request for a hearing from CHN Housing Partners, represented the Department of Development. If you will identify yourself, please.
Good afternoon, Sarah Parks Jackson with the Department of Development. We are here today because we are moving forward as quickly and rapidly as we can with our emergency rental assistance funding. Early on, we received $25.4 million. We have actually spent all but about $700,000 of that. $500,000 of it will be in a contract with CHN Housing Partner. The remaining $200,000 is under contract with Legal Aid, and they are spending it monthly as they assist with with renters who need help with court and other issues that Legal Aid can assist with, case management and other areas. In this year, we also received ERA2, Emergency Rental Assistance 2 funds from Treasury, and that was $26.9 million that we are working to get out to the residents of Cuyahoga County. May I add that the ERA1, the first tranche of dollars that came directly to the county, we used for county residents, as the city of Cleveland also participates with us in the programming through CHN. So the city of Cleveland's funding went to city of Cleveland residents, and the $25.4 $4 million is to county residents. Our ERA 2, we said was countywide, was $26.9 million. In the interim, we received an allocation of $51,233,575.56 from Treasury due to the state of Ohio received like a $400 million allocation of emergency rental assistance funds. They gave back to Treasury $100 million. Before they did that, they reached out to cities and counties within the state of Ohio to let us know that they were going to give the money back and give us the opportunity to request additional funding. We requested the additional funding. We did not state an amount, and we received over half of the dollars. So while we were doing that, we were contracting out the ERA 2 funds for CHN to be able to assist residents. That brought us to a stop because we now had $75 million, all that needed to be programmed. So the contract that we were doing for ERA 2 and for ERA 2, we stopped because we needed to add the ERA 1 money because it expires by statute at the end of the year. So now we're working on the contracts and we're moving forward. We find out from Treasury as they continue to provide us with updates on how we can program the ERA 2 money that we needed to move a little quicker to get those funds spent and out the door in an effort to draw down the additional funds. The allocation from them was 40%, and to draw down the half of the remaining funds, we need to show them that applications are approved. So we have been working with CHN Housing Partners to get all of this funding out to the residents of Cuyahoga County who needed to pay past due rents, and we can also pay past due utilities, and we can pay forward rent up to 2 months, and we can pay utilities. So I just wanted to give you some background on where we are. Along with the ERA 2 funding, we also have housing stability contracts, which you will see later, in the tune of a total of about $2 million. That funding is going to 5 different nonprofit organizations, Legal Aid being one, Famigos Foundation, ESOP, Front Steps, and Frontline. Those folks will assist the residents of Cuyahoga County with the services to keep them stably housed, assist them with getting assistance from CHN for the Emergency Rental Assistance Program, and other needs that they may have, and it's an eligible activity under ERA 2.
A point of clarification, Ms. Parks-Jackson. The ERA 2 is 26.9.
ERA 2 is 26.991.
Okay, can you let me roll on the balance of that? And it expires when?
We have to draw down. It expires 9/30/2025. The glitch in that Treasury has informed us of is that we have to draw the money down by the end of this year. Yeah.
Okay. So both pools of money need to be drawn down by 12/22?
12/28/2022, the ERA 1, which I call the reallocation money from the state, actually has to be used. And that's by statute. It was originally September 30th of 2022. Because we received reallocated funds, we automatically got a 3-month extension as to other people in the country.
And so when do you have to have ERA 1 drawn down by?
ERA 1 has to be spent by 12/28/2022. We have the money. They sent the money directly.
Drawn it down.
Yeah. So we just have to, we report monthly, and we'll have to show them how much we have expended. ERA 2 we have to have drawn down from Treasury to the county by the end of the year.
And you've drawn down 100% of the 25.4?
Yes, and spent the majority of it.
All right.
So, if I may, I'm going to ask Kevin Noak, the CEO of CHN Housing Partners,
Okay.
to come up and talk to you about the rental assistance program, the need that we have in Cuyahoga County, and other relevant information.
And how they're going to get this all done last week?
Yeah.
Okay.
Because they're good like that. Kevin?
As Kevin makes his way, does anyone have any other questions?
Yes. I have a question as to what has to happen for money to be drawn down.
We have to have, I think, $4 million by the end of June that has been approved. According to Treasury, we have to be able, when we show our reporting, we provide them with a list of residents who need rental assistance who have been approved. As long as they are approved, whether we have cut a check to the landlord or not, we can submit that list to Treasury and then therefore draw down half of the remaining dollars.
But we have to pass this legislation in order to do any of that.
Yes, because CHN
what they're coming forward with today is pivotal, even though there isn't a piece of legislation attached, unless I missed it when I got here.
No, I believe it's still going through the system.
But it is incredibly important because the first date, as I understood it from staff and from the team at CHN, is that we have to be able to have legislation that approves its drawdown and use for this first tranche by the end of the month. Is that correct?
Right. Well, actually, we had to meet a April deadline, so when you actually see the legislation, it will show the agreement as being effective April 1st.
Okay.
And it's for that reason that we met that, and because we were in the process of allocating the ERA $1 to CHN effective April 1st and had to stop once we got clarification from Treasury on ERA 2.
I can't hear you, Dale.
We do have have a couple items in the fiscal agenda for the next council meeting that relates to this money. So that's the first step.
So I was going to ask you if we could jointly discuss these on the next agenda. You have the draft legislation, because it's incredibly important, as I'm getting a briefing from CHN and from staff, that we move this forward. And I wanted to have community development listen to it, as well as your community, so that we could potentially vote on it next week.
So normally the fiscal agenda doesn't go to committee. It's normally passed on first reading suspension.
So you'd be willing to support that?
I'm willing to support that. It's routine and necessary.
Okay. Yes, ma'am.
I'm sorry, I didn't hear what that was. The state contributed of money that they were going to return to this treasury. How much is it that we received per your ask? Your request from them?
They returned $100 million to Treasury. We requested an allocation without an amount.
And what did we receive?
We received $51,233,000.
Which would have all been lost to Ohio if we had not requested it.
That's correct.
Is really...
City of Cleveland received $5 million of that 100, and we received the 51,233.
I thought that was incredibly important. So thank you, Nan, that our team recognized that this money was not going to be available to Ohio if everybody passed on it, and that Sarah and Paul and the administration reached out and lassoed this $51 million for us.
That's why I'm asking, how long does this $51 million need to be spent? How much time do we have?
It should have been spent last week.
Well,
we have to the end of the year.
And so you have end of the year for this too?
Yes.
Wow, so you have deadlines for...
That's the reason why it wasn't on the agenda previously, and I asked for the courtesy of y'all to come in at 12 today, because this money came to us kind of serendipitously because our staff was out there trying to be proactive on behalf of Cuyahoga County, and I want to make sure that we get a chance to the only craziness should be at this front end. We can reduce some of that craziness if we get this before the body next week. And so this was the only way I knew how to move this forward. So you understand my angst and why I guess you got called 2 or 3 times to be accommodating. And I'm incredibly grateful to you and Sunny and Dale for coming to this meeting, because this is an unusual event that we get 51,000 that were, in essence, was pulled from the jaws of Treasury.
51 million.
I'm sorry, 51 million. Thank you.
It's just one-time money, right?
Yes.
One-time money, end of this year, along with another 26.9 million end of this year.
Yes.
Is the ERA one-time money, or is that?
They're both ERA. The ERA 1 was done under the previous administration, has had the 1 extension that took it to September, and then the people with reallocated funds got an extension to the end of the year. The ERA 2 is also by statute, but that's a drawdown. So as long as we are able to draw down all of the funds before the end of the year, then the deadline for usage is 2025. But you've got to show that, you have approved people, which means you have to pay them. So we had this conversation with Treasury. It's the same thing.
You've got to have a plan.
Yes.
I appreciate that. Thanks for the clarity.
And I will say, before Kevin comes up, that without the partnership and the cooperation that we have had with CHN Housing Partners, we would not have been allocated that $51 million. We were allocated that $51 million because of how rapidly we deployed the original 25-4 of the ERA 1 that was directly given to the county from Treasury. So we have RFP'd both ERA 1 and 2, and CHN Housing Partners has come ahead of the pack in being the entity to administer these funds on our behalf. So on that.
All right, Kevin, you have 4 minutes.
Thank you, Madam Chair. Thank you, Ms. Parks-Jackson. Kevin Noak, Executive Director of CHN Housing Partners. Good to see you all today. As you know, we've worked with Cuyahoga County and the City of Cleveland to create a system that has become one of the most successful in the country in deploying rental assistance, and it really has been a collective effort. We've worked together to plan, implement, continuously improve. There were no best practices how to do this at the very beginning, and actually we've created some of them, and that playbook that others are replicating. It's an unprecedented effort. It's been a lot of work for everyone, and we're grateful for the confidence that's been placed in the work so far and the work we still have to do. To give you some snapshots, July 1st, 2020, we began this program. We've deployed a total of $61 million in rental assistance programs in Cuyahoga County that have kept residents housed. That represents over 15,000 payments to landlords. That breakdown is between the city and the county. There were about $26.8 million deployed in the city. There were $31.2 million approximately deployed in the county. Those dollars were dollars from the county, approved by this or recommended by this body in part. The City of Cleveland, as well as additional dollars from the state that we were able to leverage outside of the reallocation that Ms. Parks-Jackson mentioned. The average payment issued has been about $5,000. The average amount of arrearages we're paying have been approximately 5 months. And we've been on average paying prospective months rent of 1.3 months, helping to keep people housed proactively. People that we've served, if we look at our households, about 78% were women-headed households, about 75% identified as African American, and about 55% have children. These families represent an average income loss of $21,000 per applicant. And we look at the turn time of this work, we're hitting a turn time between 30 and 45 days for applications, from application to payment. And a question that you may have is, does this need still exist? At the height of the pandemic and the need, we were seeing over 100 applications a day. Right now, we're in the month of May, we saw about 38 new applications a day, totaling about close to 1,200 in the month of May. We plan to continue to accept those applications as part of this program, as well as do additional outreach to potential tenants and landlords to help streamline the process. Thank you.
We still have significant need in Cuyahoga County. Madam Clerk, what's the next step we need to take since this is unprecedented?
This item is going to be introduced at the council meeting.
And we can pass it under suspension?
Correct.
Okay. Do I need to take a vote?
No, you do not need to take a vote today.
Thank you for your time, Mr. Noak.
Madam Chair, a quick question. Where are we at right now? How much foreclosure activity is going on? Is it, are landlords still holding off, or is it starting to be pretty prevalent?
Yes, yes, if we look at foreclosure and eviction activities, we're seeing an increase in both, across Cuyahoga County. Landlords want to see rent paid. And we're making sure to work with the various housing courts throughout Cuyahoga County to coordinate. So if someone, and we've had this prerogative throughout the entire program, if someone is in the eviction process, they'll get priority to make sure that we can help to alleviate their housing stability issue.
That reminds me, one of the reasons to try and expedite this was that the courts have asked for this money to be expended as soon as possible, since there are many families who have written commitments but no cash, and once it gets beyond 15 days, landlords are like, where's the money? And so that was another reason that staff and the staff at CHN asked us to hear this as soon as possible. So without any further ado, if there are no other questions from my colleagues, thank you for your attendance today, Mr. Noak, Director, Deputy Director. Thank you both for moving this through the system quickly, and we will see you next week. If there is any miscellaneous business, I'm going to move adjournment. Thank you both.